Hello and good day from whatever part of the world you are joining us. It's a beautiful new year. Yes, it's the end of January, but it's still new year for me to you, directly speaking with you on a live session just like this, or in a live session just like this. Yes, we've been communicating via email, and what, you're not on our mailing list? Oof. Go right into our website and join our mailing list. Sign up for the newsletter so that we get to speak more often. How was the holiday? I hope you're able to get some good rest, rejuvenation, good family time, or with those who love you and who you love. And you've been able to reset and recalibrate for the new year. Now, in this year, in 2026, we at QBS Global are looking to how we can help you and your organization achieve sustainable excellence in 2026. So, what better way to start up our conversations, quality conversations, the webinar series, than to say we are looking at collaboration, unlocking sustainable excellence in 2026. Hey, let's go, let's roll. So, like I said, welcome to Quality Conversations 2026. Did you see my title page? It's my title page. All right. Now, sustainability. Like I said, the topic is collaboration, unlocking sustainable excellence in 2026. Now, sustainability. When you think about the word sustainability, anybody who's been in corporate circles or in any circle at all, you've heard the word sustainability or sustainable, and it's been bounced around a lot, everybody's thinking about it as going green, recycling, doing anything that will make sure that the earth stays safe, the earth stays sustainable, the earth can sustain us, and our habits can also cause the earth to remain in a state at which it supports our existence, right? Now, in healthcare, we're going beyond looking green. We're looking beyond, but before I go further, you look at the typical icons that reflect sustainability, and you see this this triad of cyclical arrows that show that there's a continuum. It's a continuum. It's something that keeps revolving, and something that shows that we are able to reinvent, to continue to be in a consistent mode of rebirth, right? That is sustainability. Now, when we look at it, it's not just about going green. It's also about how we are able to grow our businesses, how we are able to grow our service offerings, how we are able to grow and remain. It's not just about setting up an organization. It's not just about starting up your healthcare facility or your pathology or your diagnostic firm. It's about being able to provide consistent services or provide excellent services consistently to your patients, to your clients at every time, ensuring that your services to them are improving, in ensuring that your organization is growing. You're growing in terms of service offerings, you're growing in terms of staff numbers, you're growing in terms of profitability, you're growing in terms of expansion, scope, reach, you're growing in terms of your general business and organizational business continuity and sustainability, if I can use the word in itself. So you're looking at all of these growths, and they don't just stand alone. They are very linked to continuous improvement. What are the odds that the same cyclical method or cyclical idea or perception or way we look at sustainability is the same way that continuous improvement is actually depicted in ISO standards? When you look at the plan, do, check, act, the PDCA cycle, and you look at it as a method to continuously improve, to continue to as a way to check that our systems, our processes, excuse me, are continuously improving. That shows us that there is a relationship between sustainability and continuous improvement. I mean, if you have the same, excuse me, I need a drink. Thank you. So if you have the same kind of depiction, the same ideology, the same idea between two concepts, you can tell that they are related, they are relatable, or they are related. So continuous improvement is related to sustainability. To achieve your organization, your service being sustainable, you need to continuously improve, right? We can't stay at a pedestal or at a particular point, even though it seems like a good place to be, and remain static there and hope to be sustainable. No, no. You and I can think about brands that were once right up there, but because they didn't move on, they did not progress, they did not continually improve with the times, they soon lost either relevance or market share or presence in its entirety, right? So we have to keep thinking about continuous improvement. Now, in this world, in this current mode of artificial intelligence, we cannot dissociate that from continuous improvement. Every organization has to begin to think about embedding continuous improvement by embedding machine learning or artificial intelligence into their work to remain sustainable. By the way, do you know that machine learning, artificial intelligence is actually a reflection of sustainability and continuous improvement? Do you know that machine learning is all about the algorithms being able to learn from either the inputs that you give or its own experiences? So everything is about learning and rebirthing, learning and growing, learning and improving. Even the AI that we all talk about now and that we sometimes defer to, right? Now, continuous improvement also has to do with this TQM and total quality management. That is why we're all about quality. You know, it's a significant part of TQM, significant part of quality management systems. Everything that you do, every interplay around that make up quality management or a quality management system has to or revolves around continuous improvement, revolves around continuously improving different strata or different parts of your system. In providing this, or in achieving TQM, in achieving quality management systems, there are so many models purported out there. There are so many models. We have the ISO, you know, following and trying to adopt the standards, implement the standards. Well, that's actually that's actually the gold standard. And there are actually different models to implementing the standards or guiding to implement the standards. One very well-known one in Africa is the slamter-slipter approach, where we're able to use a 5-star graduated model to help in organizations, you know, make sense of the ISO standards, the requirements of the ISO standards, and gradually get to a point where they say, okay, here we are, we're at 0 stars. This is our starting point. This is our baseline. We grow to 1 star, we grow to 2 stars, and at 5 stars, we're like, hey, according to the model, we have everything in place. We can apply for accreditation. We can prove to the world that we have a quality management system in place. At 5 stars, yes, we should have If we have 5 stars, then we actually have an effective quality management system in place. Now, the SLAMTA project has been in existence for, well, quite a considerable amount of time now, over a decade. And it has been implemented, as you can see there, the timeline 2013, it has been implemented in 1,643 laboratories. This is specifically for laboratories now, in 56 countries across Africa, Asia, and that. Now, among the from the 1,643 laboratories across the countries that SLAMTA has been implemented in, 432 across 31 countries have been able to attain accreditation. Accreditation is a public recognition, is a formal recognition that says, yes, we are operating according to international standards, international best practices, peer-reviewed best practices. We are operating in according to a model that reflects our alignment to international best practices, right? Now, this being a good number, 432, in itself, it's a good number. It's an achievement. It's a very good achievement. If we look at it in terms of growth and in terms of comparison with growth between it and, let's say, other industries, let's say other provisions, the aviation sector, the FCMG, yes, it's not apples to apples, but let's look at growth. You'd see, or we can agree, that this is actually, we're hitting less than half, actually less than a third of the country, of the facilities that have implemented the SLAMTA program, achieving accreditation. Now, this begs the question, why? Why are so many organizations on the journey and just a few able to hit, let's call it, the mark? Why? What's going on? What's actually the impedance? I mean, I've thought about it. This is a 12-year this is a 12-year cycle, a 12-year timeline, and we have a 432 at, and there was that sharp rise between 2016 and 2022, between those 6 years, and it appears now to be kind of plateauing. Shouldn't it be having that increased, that sharp continued growth? Why are we having that, that bend, that curve, that sharp curve, that curve going on there? It's a food for thought. Now, here are some things that also are mind-boggling for me and for us at QBS Global. In Nigeria, we have healthcare, like I've explained, accreditation is a mark to say we are achieving this, we are working to this at the standards. It's a big badge of honor. Put it here on the shoulders or put it right across the chest. It's a big badge of honor. Now, according to the census data that we have from 2023-2024, aggregated, juxtaposed against the NHIE provider list and aggregated by Gemini, we have 40,017 healthcare facilities in Nigeria. Of this, a whooping 96.1 are not accredited. Now, you don't do the work. Hardly do you do the work of implementing QMS, working to those high standards, and don't go further to have a badge of honor from however you're able to get it, right? You want to get a recognition for that work. You want your clients and your patients to be able to repose that confidence and trust in you. Just 3.9% of this number has an accreditation. Okay, and evidence of QMS implementation. Let's call it all the way to 5 stars according to the SLAMTA or the SLIPTA model. This does not mean that only 3.9% of healthcare facilities have QMS at all. But of course, we cannot be looking at 3.9% accredited and be thinking that we have 50% having QMS, even at 3 stars. No. Okay, let's go further. When you're looking at the absolute numbers, right, the volume, you're looking at about 29,000, okay, 362 in the public sector and about 10,000 in the private sector, of which you can't, it's not 10%. It's not, it's a very, 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 very small percentage, less than in hundreds, okay, less than 1,000 private, of which the private sector are higher, but less than 1,000 private enterprises or healthcare facilities have this attestation of QMS implementation. And the numbers are even less in the public sector. When we look at it for the percentages, we have a very, very shocking 1.7%. And this is not to bash public sector. We have a lot of good things happening in the public sector. I am so proud of a lot of organizations in the public sector that have achieved a lot, that are doing so much. And the individuals, the healthcare professionals, you are working so hard to implement as much as you know, as much as you can, as much as your resources allow and can afford. It is a very commendable effort that has been put up so far. Very, very commendable. The outcome, unfortunately, is not commensurate with the effort that has been put in. The outcome of really having that QMS done, having it, of course, there's no Eldorado with QMS, but at least having it to a point where there can be a public attestation, a formal third-party recognition of your work, it's not commensurate with the input or with the efforts that's been put in. And in the private sector, as much as it is still a meager 9.81%. Of which a lot of resources have been put in, a lot of work is being put in, a lot of resources, a lot of external resources, external to Nigeria, are being put in. But unfortunately, we're having just 9.81%. That's telling us that 1 in 10 private healthcare facilities, more than 1 in 10 or less than 1 in 10 of private healthcare facilities are able to boast of a QMS system being properly implemented. And I can tell you from experience that this is an accurate, maybe even a little ameliorated data set from experience. So if you walk into 10, maybe just 1 has a level of QMS, a good level of QMS implemented. Let's look at a couple of case studies, or let's look at one case study. Now, we look at Rwanda. In Rwanda, we have what is called health builders. Health builders is more or less somewhat like an NGO that is totally, local to Rwanda. It's indigenous, sorry. It's indigenous to Rwanda. And health builders, sorry, before I go to that, I don't want to show you the data set yet. Now, health builders engaged a protocol where they went through a mutual learning loop. Okay, they created a learning loop that looked at they typically look at organizations and help them to grow, help them to improve, help them to bridge gaps between where they are and what good or what good high performing or adequate healthcare provision should look like, no matter where they are. Now, instead of going top down and looking at, oh, this is where you are, and doing that whole top-down auditing, they do this peer side-by-side mentorship where they bring experienced healthcare establishments side by side, or healthcare professionals sitting down with the clinics and say, okay, this is where you are. This is where your data shows that you are. Where can you go? Okay, what are the lowest hanging fruits? What has my journey been? What have I gone through? Where can you go next? Right? And then this mentor looks at and begins to think about the logistical constraints. Now, because they are in the same terrain, they understand the same factors that they are having to deal with, that their colleagues are dealing with. They can look back at their journey, and with an understanding of the specific logistical constraints that that organization or that region should have, they're able to prefer solutions. They're able to suggest um uh, 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 they're able to suggest workarounds, right, for bridging gaps and for achieving solutions to best practice, or to improving the level of care that they are giving, or the level of service that they're providing. Now, they also, in Health Builders, are able to build this performance-based financing model, right, where the quality is measured by the community's health outcomes, which is the bane of any quality drive. What is the health outcome of your patients? What is the health outcome? It's not about being able to release a result, like I always say. It's not about being able to release a result. Put water in an equipment, run it, a result will come through. It is, what is the value of that figure to the clinician? What's the value of that result to the health outcome, to the diagnosis and the care of that patient? What is the health outcome? So at Health Builders, they're able to work with a system that looks at quality not by the number of check boxes ticked off, but by the health outcomes in the community. Okay? And this very tied to this is how the clinic is able to remain sustainable and continue to grow when the mentor leaves, when the NGO leaves, right? Or when the NGO leaves. So the mentor works with them. So this entire model, and it's actually a lot more elaborate than I've explained, is something that they're able to use and be able to achieve a lot of development and growth across healthcare systems, across healthcare facilities, especially primary healthcare facilities in districts in Rwanda. The results are, or the outcomes are, so mind-blowing. From when they started in 2016 with just about a little over 50% of the grading of healthcare facilities able to implement good leadership and management, or being rated as having good leadership and management, they were able to hit over 80, if I remember correctly, I think it's about 82 or 83%, thereabout. I think 85% at the 2024 survey, or 2024 data cycle, percent of the leadership and management, performance in leadership and management by healthcare facilities in those districts, by peer-to-peer learning, by learning from others, by collaborating, by working together. Do you see? For the quality of care, and I just brought two out of, they have quite a number of statistics there, but I brought forward two. They're able to achieve this performance score in the quality of care and quality of care and customer care standards from just about 40% to over 65, if I remember correctly, over 65% rating or performance score in the health centers. And you can see, sorry, I cut ahead of a bit. You can see that this is a peer-to-peer, someone who has been in this cycle, on this path before, in these shoes, understands you. You're on the same level. They're able to collaborate and say, hey, this is how I went, this is how I went through these hurdles. There are others, there are several others. There's Ampath in Kenya, there's uh life I'm forgetting the name momentarily now. Life Builders or something in Liberia, and then there's the peer learning district initiative that was implemented in Tanzania. And I'm sure there are very many others that I'm not talking about. And I'm also sure that it doesn't mean that each of these organizations, all of these organizations are accredited, but it does mean that it does show the amount of growth that can be achieved when collaboration happens. And that is collaboration. You want to fix a puzzle. You want to fix a puzzle. Have you tried fixing a puzzle alone? And have you tried fixing a puzzle with a sibling, a friend? First of all, do you realize that the journey is more interesting, right? You would agree with me that solving a puzzle with a friend or a sibling or a spouse or a child, a loved one, is more interesting than solving it alone, right? It's more fun. You're able to work through the hoops together. You banter, you laugh at your errors, you make light of your errors. You don't beat yourself up compared to when you're solving the puzzle alone. When you're solving the puzzle alone, you actually can tend to feel some kind of strain and stress. Like, oh, where's this piece? I thought I saw this piece. I thought I saw the other piece. But doing it with friends, doing it together, you laugh at your people. How can you put that piece there? What are you thinking about? Okay, does that look like, and you begin to, you laugh about it. And in no time at all, the puzzle is fixed. And you all celebrate together. You celebrate the win. That is how working and putting together your quality management system, implementing a QMS in your facility is like putting a puzzle together, because there are all sorts of moving parts. And it is definitely an uphill task. This can explain why you have the numbers plateauing, even though there is that very accredited and validated model, the SLAMTA and SLIPTA model, or SLAMTA model for implementing QMS, and the SLIPTA model to helping you see where you are. The numbers are kind of plateauing. The numbers are kind of plateauing because we are working alone. We are trying to work alone. We are trying to do everything on our own. We're trying to achieve the journeys on our own. But imagine how much fun it will be when you're fixing the puzzle collaboratively. Okay, you're able to win together. You celebrate small wins. Oh, we fixed the first line. Yay! Let's fix the bottom section. Yay! Okay, you fix this top. I'll fix this bottom. Have you done? Can you find out? That it looks like this piece you're looking for is right with me. Oh, I found the piece you're looking for. That's the tree. You see, it is so much fun when you do it together. It is so much fun when you do it together. So, in this very, very short conversation that we're having today, sustainability in quality management is actually achieved when the science of improvement becomes a shared language between partners rather than a top-down mandate. So like I shared in Health Builders, it's not about just getting a consultant to share even though we are happy to do that, we're doing that, but we are seeing more and more that this is not helping organizations to move faster. The same pitfalls that we see in in client with client A, we see reflected with client B and C and D, and we're thinking, hey, if they've been able to overcome this in client in client is been able to overcome this, we guided them to doing this and achieving this. I wish there was a way clients B and C, before they even engaged us, we're speaking together, we're in, because we find that a lot of organizations are in similar positions, in similar groupings, in similar strata when it comes to how far along they are in QMS implementation. Some are at the very basic level, just starting out, putting the frameworks in place. Some have started, have a few resource persons here and there, have team members that have been exposed to it one way or another. But of course, QMS cannot be built by an individual. You can't employ a staff or put a staff from another organization and expect the person to build QMS for you. It wouldn't work. It doesn't work that way. QMS is not built by an individual. QMS is a system. And so you build a system, right? Now we see that, we have some other organizations that have a few people here and there who can actually be drivers, who can actually train trainers, who can actually train their peers, who can, lead conversations, who can shorten the learning curve. And we have those who are way up there, who have a lot of things going for them, just a few gaps here and there, and they can receive a formal attestation to the work that they have done. And we have these groups. Yeah, there are a few gray areas in between, but you can largely categorize into these three segments. But everybody's working in silos. And then you have people, going through the same cycles across the similar tiers. And we're thinking to ourselves, how can we help organizations circumvent this? How can we help organizations, learn from mistakes or the positive experiences or the learning experiences of other organizations within the same groupings that they are? Sustainability, reducing your costs, working lean, learning from other experiences, growing, improving your service your service efficiencies, improving your patient outcomes, ensuring business continuity, leaving a legacy. All of these, establishing your quality management system, achieving accreditation or attaining accreditation or certification, depending on the organization that you are in, all boils down to shared learning. Shared learning. So sustainability in quality management is really achieved when the science of improvement becomes a shared language between partners, rather than a top-down mandate. It's not about bringing somebody in to say it to you. You can go faster. There's a quote that we learned, or we most likely have heard. It says, if you want to go fast, go alone. You want to go fast. But if you want to go far, go together. Go together. We have seen countless clips of marathons being run where people forget about themselves and help others to cross the finish line. That is it. Because QMS implementation is not a sprint, it's a marathon. So I am starting off this year saying, you want to be sustainable in 2026. You want to achieve excellence that continues, that goes beyond buying a 350 slice CT scanner, right? That goes beyond buying a high-end equipment and installing it there and saying, hey, to the world, we've bought an equipment, but about being able to continue delivering excellence at every point in time. The key word is collaboration. It's collaboration. Look at those who have been able to achieve it. Look at those who have been able to keep growing. The key is collaboration. There are so many examples in Kenya, who I have a lot of Kenyan counterparts, very good friends. Hi, Kenyans. The key is collaboration. The key is collaboration. Think about sharing your language, sharing resources. Look, don't be afraid of losing. You see, this selfish silo, pardon me, way of operation and thinking that, oh, my customers, my clients, my patients will go. They will not go. The more the options, the merrier. We currently have, what statistic I saw? Okay, I can't remember, so I'm not going to quote it, but something very abysmal, more like one for every, yes, I think I remember that, one for every 1,000 patients or people is what our current numbers in Nigeria are. One healthcare professional, one doctor for every 1,000, when it's supposed to be one to, I think it's supposed to be 1 to 100. If I'm not mistaken, pardon me if I made a mistake there. I didn't check that recently, but the last time I remember that data, I think that's what it was. We are having, and that is for doctors in total, and then for nurses, it is worse. For healthcare, the way you pull it down, aggregate it for healthcare professionals is just mind-blowing. But there are systems that actually have it much better. And yes, we are fraught in Africa with a lot of troubles, with a lot of challenges. Yes, we are. Our systems are fraught with a lot of challenges. But see, with partnerships, there are organizations that are achieving this. With collaboration, we are able to, which is, I think, is the next thing. Okay, not the next, I think is the last one. We're able to bridge the gap between those the haves and the have-nots. This is something that is a thing in Africa. There's that wide, well, not only in Africa, there's that wide divide between the haves and the have-nots. And we are having an increasing erosion of the middle class. Now, we are trying to bring that together. Let's collaborate. Let's collaborate. And it's not about going to, have a, parasitic kind of relationship with another organization. No, it's about having a peer-to-peer. You're growing together. Believe you me, in every strata, there are people who are a little higher, there are people who are a little lower, and who can learn together. We fix the puzzle together. Let's close this out. Sustainability is therefore achieved when the outsider, like us, becomes invisible. And your system, your local system, you become the sole owner of your standards, of your processes, of your system. We are not excited to be the organization that helped us achieve it. Yes, it's a good thing, but we don't want to just be that organization that everybody, the leadership has to keep defaulting to, the people have to keep saying, oh, KBS Global, give us this, KBS Global, we have to do that. We are happy to do that, right? But we want you to be able to walk far in the spirit of Ubuntu, the African spirit of Ubuntu, move together, right? Build collaborations, build networks. We have very few networks of health systems, which is something that actually exists a lot of out there. You look at the NHS, you look at in the US, you have health systems, you have you have health networks that grow together and replicate success models into other organizations or into their partner organizations. That is what we're trying to help help you to see. So improving healthcare, therefore, should not be a lonely battle. Okay. Instead of reinventing the wheel at all times, let's look at the hospitals, the facilities across town, across the street, or across the state that have mastered the challenges that we're still facing. Okay. And then true sustainability just comes from learning from each other's wins. So you don't need a new playbook to transform the care. No, you just need to find, who have, like I was saying earlier, who are the local trailblazers? Who are those who have gone ahead? And then just bridge that gap between those who are struggling now and those who have actually gone through and succeeded in those same areas that we are struggling. And those people sometimes are in our backyard or down the street or across the town or across states or across the country. And when we do this, excellence is something we are able to build together. It's something we are very, very able to build together. And that said, I ask you, what is your biggest takeaway? I really want to see it in the chats. So drop it in the comment section. What is the biggest takeaway from? What are your musings on this? What do you think? What do you think about this? And who would you partner with on your journey to sustainable excellence in 2026? There's a lot we can achieve in 2026 when we collaborate, okay, and partner together. And let me tell you, you don't have to work alone. You do not have to work alone. We're actually building this community where we can learn together, where we can grow together. We are actually building the community. QBS Global is building the community. We've started already, and it exists. Okay, you see the link. Join us and join your peers. Okay, find a network. Find people who are in the same area with you, and let's help you to achieve a lot. Achieve sustainable excellence 2026 with partnerships, with collaborations, not just within your country, but across countries, especially within Africa. Thank you very much for your time and your attention. This rounds up our conversation. Okay, we're on social media. Follow us. And here we have the community, qnet.qbsglobal.org/sign up. Or if you go to qbsglobal.org, you'd see two options, what we do and join our community. That's the very first page. Then you can go to join our community, and then you'd be able to partner with other organizations and begin to work your partnership. All right. Thank you so much for your time. And I look forward to hosting you in February. And you would hear more about what we're going to be talking about in February by or via email. It's a big year. It's a big year. It's a really big year. Thank you so much once again. And I would leave you with this slide. Who will you partner with on your journey to sustainable excellence? Thank you so much. And do have a wonderful, wonderful rest of the month, a beautiful 2026, an excellent 2026, and a growth-filled 2026. See you in February. Bye.